Just when Leo Marvin thought he was getting away from it all,
As of this afternoon, I'm taking my family on vacation.
his old friend Bob Wiley showed up.
Dr. Marvin!
Oh my God.
I really appreciate this.
I don't want any of you letting Bob into this house.
He's a sweet guy. Didn't you invite Bob over for dinner? Would you like some more chicken, Bob?
Will you stop that, please?
You're angry.
No, I don't get it.
You're upset.
Relax, Leo. Take a vacation.
I'm on vacation!
Touchstone Pictures presents Bill Murray
Hello, I'm Bob. Would you knock me out, please?
and Richard Dreyfuss
This man is crazy! Get out!
Why'd you need to kick Bob out of the house?
He's not gone. That's the whole point. He's never gone!
Is this some radical new therapy?
You see?
What About Bob? Rated PG.
What About Bob is a movie that depicts a man that is seen to have a multiphobic personality characterized by acute separation anxiety. This basically states that Bob suffers from a variety of phobias, which are said to be an anxiety disorder in which an irrational fear causes the person to avoid some object, activity, or situation. Phobias can be developed in a variety of different ways, including genetic and environmental factors as well as traumatic events. People with anxiety disorders such as Bob are also more susceptible to developing phobias. The anxiety brought on from these phobias have brought Bob a variety of symptoms. Though they may be exaggerated in some aspects, some of these symptoms can be seen in patients with this type of anxiety disorder.
Why don't I start? Huh? The simplest way to put it? I have problems. I worry about diseases, so I have trouble touching things. In public places, it's almost impossible. I have a real big problem moving.
Talk about moving.
As long as I'm in my apartment, I'm okay. But when I want to go out, I get weird.
Talk about weird.
Talk about weird. Well, I get dizzy spells, nausea, cold sweats, hot sweats, fever blisters, difficulty breathing, difficulty swallowing, blurred vision, involuntary trembling, dead hands, numb lips, fingernail sensitivity, pelvic discomfort.
Although Bob suffers a variety of different phobic disorders such as elevators, buses, and sailing, he also suffered from severe separation anxiety, which can be seen through his many attempts to try and locate his therapist, Dr. Marvin, while he was on vacation.
Mid-Manhattan Exchange.
Yes, this is Bob Wiley. I'm a patient of Dr. Marvin's. I have to speak with him right away. It's urgent.
I'm sorry, Mr. Wiley, but Dr. Marvin's
It's
out of...
Bob. And you are?
Betty.
Betty. Hi.
Bob, Dr. Marvin's out of town and Dr. Harmon's taking his calls.
Hello?
Doctor, it's Betty again. I have an urgent call from your sister.
My sister. Put her through.
Go ahead.
It's not you. It's me.
Lily? What's wrong?
Dr. Marvin, please don't be angry. This is Bob.
Who is it?
Detective Roberts from Homicide. I have some questions about a Bob Wiley.
Bob called here trying to reach his psychiatrist.
Oh, well, where is he? I'll have to ask him some questions, too.
Dr. Marvin's on vacation in New Hampshire.
New Hampshire?
I can get him on the phone for you.
Good. No, don't. If I really need to, I can have somebody from NHPD drop by, but what if I wanted to write him a letter? Would you have a mailing address of some kind up there?
Oh, sure.
Separation anxiety in adults can be seen to cause extreme anxiety in people who are separated from major attachment figures. In Bob's case, it's his attachment to his therapist. However, children also suffer from separation anxiety disorder. Children who suffer from this disorder become excessively anxious when separated from their parents. The movie What About Bob does have some aspects and symptoms that can be seen in people with these disorders. However, This movie exaggerates these aspects greatly for entertainment purposes. That is why I feel this movie leans more towards Hollywood than it does to reality.